Hello everyone, this is Ru. This is my topic for rapid fire presentation. As a background, we have 3 different types of stretching, and by stretch we can get multiple benefits. However, there's no study comparing a functional and structural change from getting different types of stretch. So the purpose of this study is to study the difference in muscle tendon parameters in lower leg after different types of stretching session. Subject, they used total of 122 subject and randomly assigned into 4 groups. Exclusion criteria, competitive athletes, and history of lower leg injury. Procedure, they obtain baseline and then they have stretching session and again they have pulse test. For the range of motion, they have patients stand straight and they used electronic goniometer to measuring the full dorsiflexion. For passive resistance torque, they have the patient laying prone with fully relaxed, and they use isokinetic dynamometers and EMG. And they measured angle between 10-degree plantar flexion and 90% of max dorsiflexion. For maximum voluntary contraction, there is no discretion for the patient's position, but the patient was kept their ankle at 90 degrees and asked to hold 5 seconds at maximum dorsiflexion force, and they did 3 repetitions. For the structural measurement, they measure muscle tendon junction displacement and length of gastrocnemius medialis and gastrocnemius penetration angle. However, by using ultrasound, but because of the low quality of ultrasound, they only obtain the data of penetration angle. For active tendon stiffness, they're comparing difference between active force and tendon length change to determine tendon stiffness. For passive tendon muscle and tendon muscle stiffness, they compare the difference between change in passive force and change in length of tendon or muscle or joint angle. For the intervention, static stretch, they did 30 seconds of stretching time at maximum dorsiflexion position. In ballistic stretch, they conducted dynamic movement at last 5% of dorsiflexion. For PNF stretch, they use contract, relax, antagonist contract technique, and each stretching session have 4 sets and 30-second stretching time and 28-second of rest time. As a result, all stretching groups have significantly decreased range of motion and significantly decreased PRT, MT stiffness, and muscle stiffness. However, only PNF group have significantly decreased penetration angle and massive voluntary contraction. In Vancouver, they found a significant difference between static and PNF group in penetration angle, and there is no significant change in any group about tendon stiffness. For discussion, in this study, range of motion didn't change much compared to the previous study, and that might be because the duration difference. Also, the current study didn't change the stretching angle in the following session, and that could be the contribution. The reason why MVC significant decrease only in PNF comes from fatigue, and the reason why there's no difference in tendon stiffness again might be because the current study didn't change the stretching angle, and penetration angle only decrease in PNF might be because of antagonist contract. Clinical application, there are so many limitations in study. However, we can say that we have to always stretch at the end of range of motion and readjust the stretching angle. And PNF might be not the best option to use, especially before competition, to avoid fatigue. Also, to increase range of motion, decrease PRT and muscle stiffness for short term, any kind of stretching, static, ballistic, PNF could be useful. Thank you so much.